You want to go back one. Yeah. All right, well, welcome and thank you for joining us for this HPV Town Hall event, HPV and our kids, facts, questions, and community voices. There are 3 primary learning objectives. Understand HPV and its health impacts, recognize the benefits of early vaccination, and address questions and concerns. My name is Kelsey Wuso, and I will be your featured speaker tonight. I am the lead public health nurse with the Clark County Health Department. My expertise lies in the program areas of immunizations and reproductive health. This topic is near and dear to my heart, and I feel very grateful to have this opportunity to speak with you all. So, what is HPV? HPV stands for human papillomavirus. It is a very common virus. A virus is a tiny germ, so tiny that you can't see most of them, even with a regular microscope. Viruses can't make more of themselves on their own. They need to get inside a living body, like a person, to multiply. Once a virus gets into the body, it enters certain cells and uses those cells to make more copies of itself. HPV infects a specific kind of cell called squamous epithelial cells. These cells are found on the surface of the skin and on moist areas of the body like the mouth, throat, and genitals. These viruses are called papillomaviruses because some types cause papillomas, better known as warts. Okay, next slide. No. Okay. So there are more than 200 types of HPV, and each type has its own number. For example, HPV-6, HPV-11, and HPV-16 are just a few of the many types a person could have. If someone tests positive for HPV, it's helpful to know which type they have because it guides follow-up care and treatment. There are low-risk and high-risk types of HPV. Our bodies do a really good job of getting rid of low-risk types of HPV over time. Unfortunately, that is not always true of high-risk types. High-risk types of HPV tend to lead to cancer if not caught early and treated. Next slide. Some types of HPV live on the skin. They are different from genital warts and are not the same type of HPV. These HPV types infect the outer layer of the skin and can cause common warts on places like the hands, feet, arms, and legs. Mucus or mucosal membranes are the moist lining inside certain parts of the body that open to the outside. These include the vagina, anus, cervix, and vulva, the inner foreskin and the urethra of the penis, the inside of the nose, mouth, and throat, the windpipe or trachea, and smaller breathing tubes called bronchi. Also, the inside of the eyelids. HPV type 6 and 11 are considered low-risk types. They usually cause genital warts and rarely lead to cancer. Some low-risk HPV types have certain proteins that may slightly increase their ability to cause problems, but they still very rarely cause cancer. A low-risk genital HPV infection can cause warts that look like small, cauliflower-shaped bumps on or around the genitals or anus. Warts can appear in places that are harder to see, like inside the vagina or on the cervix. HPV type 16, 18, 31, 33, and 42 are examples of high-risk HPV types that can cause cancer. These types of HPV can sometimes hide from the body's immune system, which means the body isn't able to clear the infection. When the infection stays in the body for a long time, it can slowly damage healthy cells. Over time, these cells can become abnormal and in some cases may eventually turn into cancer. High-risk HPV types are known to cause 6 different types of cancer: cervical cancer, anal cancer, vulvar cancer, penile cancer, vaginal cancer, and cancer of the mouth and throat, otherwise known as oropharyngeal cancer. For this presentation, we will be covering cervical cancer in more detail, in addition to talking briefly about mouth and throat cancer. Cervical cancer is the most common cancer caused by HPV in people who have a cervix. Almost all cervical cancers are linked to HPV. The good news is that cervical cancer can be prevented with the HPV vaccine and regular screening. Routine screening can find cervical cancer early or even prevent it. So let's talk about those screenings. People who have a cervix can be tested for HPV. A primary HPV test checks for high-risk types of HPV that are more likely to cause cervical precancer or cancer. This test is usually done by a healthcare provider during a routine pelvic exam. They use a small brush or tool to gently collect cells from the cervix. Another option in some settings is self-collection, where a person uses a kit to collect a vaginal sample themselves. This method does not require a pelvic exam, and it can be done privately in a clinic, a doctor's office, or even at home. A Pap test is a different test, but it is done the same way as an HPV test. It is highly effective at finding precancerous cells early, allowing for treatment before cancer develops. The American Cancer Society recommends that anyone with a cervix who has an average risk of cervical cancer start screening at the age of 25 and continue through at least age 65. People at higher risk of cervical cancer might need a different screening plan, such as being screened more often. The preferred screening option is primary HPV testing on a cervical sample collected by your healthcare provider. This should be done every 5 years. Other options for cervical cancer screening include self-collected HPV testing done every 3 years, co-testing every 5 years, and this is when HPV testing is combined with the Pap test, or a Pap test alone every 3 years. Just as a note, the FDA has only approved tests to find HPV in the cervix. Research is still being done on HPV tests for other parts of the body. For example, there are commercially available oral HPV tests that are not yet FDA approved or included in screening guidelines. However, some dentists use them. There's also no useful test to find out a person's HPV status, because HPV can infect different parts of the body, and an HPV test result can change over a period of months or even years. HPV is found in many oral and throat cancers. Most cancers found in the part of the throat behind the mouth are HPV related. These are the most common HPV related cancers found in men. There's no standard screening test to find these cancers early. Still, some can be found early during routine exams by doctors, dentists, or dental hygienists, or by doing self-checks. HPV is very common. The Centers for Disease Control and Prevention estimates that 43 million people in the United States currently have HPV, and about 13 million more get a new HPV infection each year. This includes both teens and adults. Each year in the United States, more than 37,000 people are diagnosed with cancers linked to HPV. The good news is that HPV vaccines can prevent more than 90% of these cancers when children get vaccinated at the recommended ages. HPV doesn't cause any symptoms, or I should say it often doesn't cause any symptoms. Because it spreads through close skin-to-skin contact, many people don't know that they have it unless they get routine testing or develop visible signs. When symptoms do appear, they depend on the type of HPV. So for skin type HPVs, those can cause warts on the skin. Mucosal type HPV may cause different symptoms depending on where the infection is in the body. HPV spreads through close, intimate skin-to-skin contact. It is not spread through blood or body fluids. Someone can pass HPV to another person even if they have no signs or symptoms. In fact, a person may have HPV for many years and not even know it. The main way mucosal HPV types spread is through sexual activity, including vaginal, anal, and oral sex. People who have had many sexual partners are more likely to come into contact with HPV. However, anyone who is sexually active can be exposed to HPV, even if they have only had one lifetime sexual partner. HPV can also spread through genital to genital contact without actual intercourse, although this is less common. You cannot get HPV from toilet seats, hugging or holding hands, swimming in a pool or a hot tub, sharing food or utensils, or by not being clean. You can get HPV even if you haven't been sexually active in months or years, or you have no signs or symptoms at all. The best way to prevent HPV and the health problems it can cause is through vaccination. The HPV vaccine is strongly recommended for boys and girls and works best when given before the age of 13, as the body produces a stronger immune response against HPV when the vaccine is given before this age versus later in life. Vaccines are used to help prevent diseases before people are exposed to the virus or other infection that cause the disease. Most people in the US have skin-to-skin contact that can spread HPV during their teens and early 20s. Therefore, it's best to get the vaccine before this. The American Cancer Society recommends that both boys and girls receive 2 doses of the HPV vaccine between the ages of 9 and 12. Teens and young adults, age 13 through 26, who have not been vaccinated or who haven't received all of their doses should get the vaccine as soon as possible. The American Cancer Society does not recommend HPV vaccination for people older than age 26. However, shared clinical decision-making can be considered for people ages 27 through 45. So, what is the HPV vaccine? Gardasil 9 is the only HPV vaccine currently available in the United States. Gardasil 9 helps protect individuals aged 9 to 45 against diseases caused by 9 types of HPV known to cause cancer and genital warts. It's important to note that vaccination does not remove the need for recommended cancer screenings, and Gardasil 9 does not treat HPV infection, cancer, or genital warts. The HPV vaccine works very well. Studies have shown that the vaccine provides nearly total protection against infections and precancers caused by the types of HPV that cause 90% of HPV cancers, as well as 90% of genital warts. HPV vaccines have been used since 2006. HPV vaccines went through extensive safety testing before becoming available. Since then, hundreds of millions of doses of the HPV vaccine have been given worldwide. Like any vaccination, there may be common side effects from the HPV vaccine that usually go away quickly, like headache or fever. There can be pain, redness, and/or swelling where the shot was given. A small number of people may have a more serious side effect that could occur, such as an allergic reaction or fainting when the vaccine is given. Anyone who has a severe allergy to yeast or any other ingredient in the vaccine should not receive the HPV vaccine. The ingredients in the HPV vaccine, like all vaccines, help make sure that it is effective and safe. Did you know that these ingredients occur naturally in the environment, the human body, and foods? For example, the HPV vaccine contains aluminum, like the hepatitis B and Tdap vaccines. Aluminum boosts the body immune response to the vaccine. People are exposed to aluminum every day through food, cooking utensils, water, and even breast milk. Aluminum-containing vaccines have been used for decades and have been given safely to many billions of people. Scientists and health organizations around the world closely monitor the safety of the HPV vaccine. Hundreds of studies and millions of people worldwide have shown that the HPV vaccine is safe. In the US, vaccine safety is monitored by several national systems that work together to make sure that any harmful effects of vaccines can be found early. The Centers for Disease Control and Prevention and the U.S. Food and Drug Administration review all serious side effects reported to the Vaccine Adverse Event Reporting System, known as VAERS, to watch for potential safety concerns that may need further study. When a child gets the HPV vaccine, their body makes proteins called antibodies. Antibodies provide protection against the virus when a person is exposed to HPV. The antibodies give strong and long-lasting protection. According to the American Cancer Society, research done thus far shows that the protection against HPV infection does not seem to decrease with time. Research will continue to look at how long protection against HPV lasts and if booster shots will be needed. Most insurance plans cover the HPV vaccine cost if it is given in accordance to national guidelines, which would be between the ages of 9 and 26. But it's always a good idea to check with your insurance plan to be sure. The Federal Vaccine for Children, or VFC program, covers vaccine costs, including the HPV vaccine, for children and teens who meet certain eligibility criteria. The VFC program provides free vaccines to children and teens until 19 years of age who are either Medicaid eligible, American Indian or Alaskan Native, underinsured, or uninsured. So, why are we even talking about this? Well, the data doesn't lie, and we have a lot of work to do in Wisconsin and specifically in Clark County. So let's take a look. This data on the screen was pulled from the Wisconsin Department of Health Services Immunization Dashboard, which was last updated on March 9th of this year. As you can see, the data is reflecting vaccine coverage rates of Wisconsin adolescents in the year 2025. That year, 52.7%, or just over half of 13-year-olds in Wisconsin adolescents completed one dose of the HPV vaccine, and only 31.2, or about 1/3, of Wisconsin adolescents completed the HPV vaccine series. On the next slide, we can see that only 31.7%, or about 1/3, of all Clark County 13-year-olds received one or more doses of the HPV vaccine, which is much lower than the state rate of 52.7. And on the next slide, this is looking at the percent of 13-year-olds who received all doses of the HPV vaccine series in the year 2025. Only 17.9%, or less than 1/5, of all 13-year-olds residing in Clark County met that benchmark. Wisconsin rates, unfortunately, are not much better. So here we are looking at adolescents between the ages of 13 to 18 who received one or more doses of the HPV vaccine. For Clark County, it's less than half at 42.6%. Wisconsin rates are better at 64.8%. However, there's still a lot of progress to be made. Lastly, this slide is showing the percent of 13 to 18-year-olds who received all doses of the HPV vaccine series. For Clark County, it's about 1/3, 34.4%. Wisconsin is just over half at 53.1%. So with that, we are going to soon transition over to our ambassador testimonial. You just want to pull up the next slide quick, Fred?
Oh, sorry.
Okay, I'm just going to give a little introduction, and then we're going to go to a different slide deck. So I'm excited to introduce our ambassador from the Head and Neck Cancer Alliance, who will be sharing a testimonial for us this evening. Thad Lurie is an ambassador for the Head and Neck Cancer Alliance. He was diagnosed with HPV-mediated stage 2 oropharyngeal cancer in 2019 and underwent radiation and chemotherapy treatment. He has been in full remission for 6 years and lives in Virginia with his wife and 3 teenage sons. So with that, we are going to stop sharing that slide deck.
And Thad, you should have the ability to share.
Okay, can you all see this?
Yes, we can see it in the present, or like your PowerPoint mode.
How's that?
Perfect. And we can hear you great.
Great. Well, thank you for having me. And good evening to everyone. As Kelsey mentioned, my name is Thad Lurie, and I'm an ambassador for the Head and Neck Cancer Alliance. I go to meetings like this with the American Cancer Society to share my story so that people can understand a little bit better, what does head and neck HPV-mediated cancer really look like? What happens if you actually get it? And kind of the downside of, if we don't get our kids vaccinated, what kind of things are they potentially in danger of? So, as Kelsey mentioned, in 2019, I was diagnosed with stage 2 oropharyngeal cancer. It actually started when I was in the shower. I was 44 at the time, very healthy, about 230-pound weightlifter. I exercise probably 4 or 5 days a week, eat a very clean diet. And so it was really surprising when I found this lump on the side of my neck. I went through several different kinds of tests after talking to my primary care doctor. First there was an ultrasound, and there was blood work, and then they did a CT scan. And then we went to an actual PET scan to look specifically after the biopsy. So there's definitely some steps that are there. Once you learn that, something does have cancerous cells, obviously, your life changes significantly. What I've talked to other survivors about is that cancer is, for most people, something that happens to someone else. It's something that happens sometimes to people we love, family members, friends, colleagues, and it's always shocking when that happens. I can tell you that when it happens to you, it's an entirely different experience, um, because then your whole mentality shifts from cancer being something that you hear about to cancer that is now something that can happen to you. So if you talk to survivors, you'll probably learn that even after they're in full remission, we still have to go for scans. We still have, plenty of side effects from the treatment, and I'll talk about that a little bit later. But really, you start to carry something a little different in that anytime something goes wrong with your body, your first thought becomes, "Uh-oh, is it cancer again?" Especially if it's in, the area that the original cancer was found. So I did receive the diagnosis. We formed an oncology team, which is generally what the hospitals do, and that's in my case going to include somebody from medical oncology, which is chemotherapy, radiation oncology, which is the actual radiation. I did not have surgery. Some types of cancers, mine included, sometimes do include a surgical element. For mine, it would have been a neck dissection, but the problem is that my cancer, it started at the base of my tongue, and then as oropharyngeal tends to do, it migrates very slowly into the lymph nodes. So I had 11 or 12 lymph nodes on the left side, and then markers of potential lymph nodes on the right side. So the treatment plan that I was given was 7 weeks of chemotherapy and 35 sessions of bilateral radiation, meaning I had radiation on both sides of my neck. Um, I can tell you, honestly, it's the hardest thing I've ever done. And I can also tell you, as Kelsey mentioned, I have 3 teenage sons. Not surprisingly, they're all HPV vaccinated at this point. And part of what I do in talking for the American Cancer Society is encourage folks to get their children vaccinated. Until more recently, girls were really the target of the vaccine. I tend to promote boys getting the vaccine as well, which is the American Cancer Society's recommendation, primarily so that you don't have to go through what I went through. It's incredibly effective. The vaccine is safe. It's not problematic. They get the 2 shots and they don't really have to worry about it again. And trust me, if you see what I went through, and we're going to talk about it a little bit, I think you'll be motivated, hopefully, to either get yourself or your children vaccinated. So on the left is a picture of me and my middle son, who is now 16, and I was teaching him to drive a manual transmission earlier today. He was obviously a lot smaller. You can see on the left, that's what I looked like before I went through treatment. The right is a picture taken on my last day of chemo. I lost just about, well, it was actually more than 50 pounds. When I got down to 180, I stopped weighing myself because it was just too hard to deal with that amount of weight loss. Head and neck cancer, specifically in men, is one of the largest, I believe it's the largest actually, and growing form of HPV mediated cancer. And so what you learn about with head and neck treatment is that the side effects are extreme. The oncology team will tell you this because the tissues are so delicate, and because your head and neck has so many nerve endings, and because it's involved in so many different processes of your body, it's really, really difficult to withstand this treatment. My first goal in getting treatment, obviously, was to get better, but within the treatment, my primary goal was to avoid a feeding tube. More than half the folks who go through head and neck radiation and chemo treatment get a feeding tube because the damage to the tissues in your throat and your mouth and your tongue is so severe from the radiation. You have sores, you have swelling, you have mucositis, which is where the mucus in your mouth turns thick and gummy. It's like you're in that dream where you have the weird stuff in your mouth and you're trying to pull it out. It's actually like that. Like I would wake up in the morning and reach in and scoop out the stuff because it's too solid to swallow and it's stuck to all the surfaces of the inside of your mouth. So eating becomes very difficult and painful. Drinking, very difficult and painful. And so what happens is some people are in danger of losing so much weight that they cannot tolerate the radiation and chemotherapy treatments. So what they do is they drill a hole into their stomach and they put a tube in and you start pouring stuff into the tube. I didn't want that for obvious reasons. Among them being once you stop swallowing and chewing, your body starts to forget how. And then after they take the tube out, some people don't actually ever learn to eat normally again. They have to keep the tube the rest of their lives. Most people with physical and occupational therapy are able to regain their swallowing function, but it's a long road and it's difficult. Thankfully, I was able to continue to push enough calories to maintain enough body weight that I could continue to withstand the treatment. The radiation was painful, very painful, and difficult. The chemotherapy is a little bit different. The radiation is targeted, so a lot of the pain and the burning of the skin and the damage is in your head and neck. The chemotherapy is systemic. They put a port in your chest and they pump it directly into your heart so that it can spread out to everywhere in your body. And essentially, it's hard to say, but the chemotherapy it's poison. And basically, you're having a war of attrition with the cancer where it dies first. So the chemo does a lot of damage and it does weird things. The side effects that you get coming out of it, some of them are extremely strange, and some of them are permanent. One of the ones that I got pretty badly was tinnitus, which is that weird ringing in your head. I never understood how I could be woken up several times a night by a sound that no one else could hear. But that is what happened. Like the tinnitus got bad enough that they actually had to dial back some of my meds in the last treatment because it also causes permanent hearing damage, which I have. The tinnitus also sticks around. So occasionally it shows up and decides to just make everything ring. Excuse me. And so you go through this treatment and you go through this process. The good news here is that specifically HPV mediated head and neck cancer is more treatable than the non-HPV mediated kind, which is generally caused by smoking, chewing tobacco, things of that nature. So the 5-year survival rates, if you do the treatment properly and you do what the oncology team tells you to do, are almost 90%. So your survival rates are very good. They're even better if you get vaccinated because you don't have to do this. But that's the good news. The tough news is that it does an incredible amount of damage to your body. And so let's talk a little bit about what that looks like. This is a picture of me with my lovely wife. We're actually eating. The first solid food I ate after treatment was about 6 weeks after I was done. I was on an all liquid diet from week 2 on. And then I was able to eat a little bit of the white of a fried egg, and we actually threw a party. It was that big a deal. When you don't eat solid food for 10 or 12 weeks, it's a lot. The good news is that, as Kelsey mentioned, I'm 6 years cancer free. I mentioned the difficulty there of going and getting your tests. The first year you go every 3 months to get scans. The second year is every 6 months. The third year is every 6 months. Then you go to annual. And then you have a meeting with your oncologist after 5 years, if it's HPV mediated, and you've been clean the entire time, and they say, okay, you're done. And I will tell you, at my 6th year, I set up an appointment anyway. It is very, very hard to let go of the idea that you might still be sick. Once you've been that sick for that long, it kind of ingrains into you. And so survivors have something that we call scanxiety, which is where a scan is coming up and you start to psych yourself out and believe that you feel things that you don't. It's really difficult. I'm back to powerlifting. I'm back to my original weight, although some of it's a little bit lower than I would like. I also believe that part of my duty as a survivor here is to give back to the community. So I do that, obviously, doing what I'm doing now, working with the Head and Neck Cancer Alliance as an ambassador. Unfortunately, and I guess fortunately, I've had 2 friends and colleagues in my circle in the last 2 years who were diagnosed with oropharyngeal squamous cell carcinoma, which is exactly what I had. So I've become a resource in the kind of DC, Northern Virginia community where I live, where if men are diagnosed with this, their friends, if they know me, they have them call me. And what I can do is just listen and give them a sense of kind of what's coming, listen to them as they're going through it. It's hard. You lose your taste. You lose your sense of smell. You can't eat. You're on liquid diet. You're losing weight. You can't sleep. You're weak as a baby. There were days I couldn't even crawl up the stairs. And so helping them understand that, yeah, it's really, really hard, but even though it's absolute hell right now, it's going to get better. That's part of what I try to do. I also work at the DoD Rare Cancer Research Program, looking at new treatments for symptoms and for the cancers themselves that are being put into the DoD channel specifically. And I work with the Immerman Mentor Angels, which is the same thing, just mentoring people that are either in diagnosis, in treatment, or finishing treatment, and moving into post-treatment stages. Having somebody there, when I was diagnosed, I let my employer know, decent sized company, about 1,000 people. And as it turned out, the chief operating officer on the other side of the company, within 10 minutes of the announcement going out, he texted me and said, "I've been through this, call me." And I immediately called him. And I remember he sat on the phone with me for 75 minutes and listened to everything I had to say and calmed me down and walked me through it and talked about his treatment plan. And he said to me what I now say to others, which is that it was really hard. But I know him and he's okay. He runs marathons, and so being able to understand that that was a potential outcome that I could work towards and believe in, it was incredibly helpful for me. And I've told him that. And so I try to play that role for other people. As I mentioned, plenty of permanent and ongoing after effects. Radiation fibrosis, I get cramping, muscle cramping in my jaw and my esophagus and my trapezius and my SCL here. Xerostomia, I only have about half the saliva that most people have. So I can't really eat dry things at all. Sometimes I have difficulty swallowing, spitting. Even now, you'll notice I always have this gigantic water bottle with me because I have to constantly refresh my mouth due to the lack of saliva. And dysphagia, trouble swallowing. I choke on water. I choke on my own saliva when I'm brushing my teeth, probably 2-3 times a day. I have these massive hacking coughing fits. To be fair, when I was coming out of treatment and those were more frequent during COVID, that was really inconvenient in public. When you're constantly having these horrible hacking coughing fits and everybody's freaking out because they're worried that you have COVID and you might be transmissible. So all that to say, things have been better. Obviously, I've survived. I'm in remission. I'm able to come and give back to the community at this point. And it's great to come and speak to people and answer questions. And I don't enjoy telling the story, but I feel like it's impactful. I've worked with, as I said, American Cancer Society, the University of Connecticut. I went and talked to their dental students. There's lots of places where you can go and just provide education and answer questions so that you can have a real conversation around what this means and why vaccination is so important. So, Kelsey, thank you so much for having me. As I said, not a pleasure, but something that I really feel is important, and I'm happy to do. And if anyone, I think we have a couple minutes. I don't know. Anyone has any questions, I'm happy to answer.
Okay, yes. And I think I can speak for the entire room and everybody online that I just feel a lot of gratitude that we have you here with us today. We are proud of you that you overcame all of that. That is just absolutely amazing. It's an amazing story. And with all of the hesitations around vaccines in general, but specifically the HPV vaccine, I believe that stories can move people. Your story is very powerful. I know I caught myself with full body goosebumps during a couple of the things that you were saying just in that short 15-minute elevator speech, I guess. And yeah, we do have like 2 minutes. I want to keep things on time if you're able to stay. Folks can ask questions during our expert panel as well. But let's give an opportunity. Does anybody have a question right now that they feel like they want to ask Thad while we have him here with us? You can either come off mute, throw it into the chat. Our expert panel members, you can ask a question too. I think that just means you were very thorough.
I'm curious. Has your son been vaccinated?
Yes, all 3 of my boys are fully vaccinated.
Figured as much, but I thought I would ask.
Yeah.
Any other questions right now?
I mean, I was just wondering, how good did those eggs taste?
Well, to be fair and honest, the first time I ate them, I couldn't taste them.
Couldn't taste anything.
I didn't get all my taste back. Most people don't. I'm lucky enough that I got some. So I got sour and I got bitter. I got salty, most of savory, very little sweet. So there's actually quite a few foods I can't eat anymore. Anything citrus I don't get any of the sweet. I only get the sour. So it's like somebody punched me in the face. Like I can't eat any oranges. Like strawberries and blueberries are very, very hard. Most times I don't eat those. I tend to gravitate more towards melon because melon is nice and subtle and gentle. What's really funny is that as it happens, your brain fills in a lot of the taste question for you. So things that I've never tasted before that I don't know what they're supposed to taste like, I can't taste them at all. And what's funny is that several times after workouts, I've taken my shaker bottle with the protein in it and I'll fill it with water and I'm not paying attention when I drink it. so I don't see what color it is, and I realize I have no idea what I'm drinking. So what's funny is that your brain actually fills in the taste for you. So when I look at it and I see it's brown, I'm like, oh, it's chocolate, and then I taste chocolate. It's really weird, but I know I've got a friend who survived not only oropharyngeal but then nasopharyngeal back to back. Like he's a trooper, and he has the same thing. Like he says, his brain is his taste organ now because your tongue is like. So I cook a lot at home. My kids have to come and taste stuff, come and taste test for me. I can do textural things, and I find that I oddly my taste buds have changed completely. There are things that I used to really dislike that I like now, or at least I think I do. And then there are things that I used to really enjoy that I don't eat at all. So it's just a lot of life adjustments. But as my kids remind me pretty frequently, this way's better because the other option is not so great.
All right. Thank you again for joining us this evening. I am going to have Corinne share our slide deck again. So we are going to be moving into our formal expert panel Q&A. You want to go forward? Next. All right. So I want to first introduce our 3 expert panel members. We unfortunately were not able to get an oncologist to join us tonight, but we are very happy with the 3 folks we have with us. So first, and if I butcher anybody's name, feel free when you come on later to say your name correctly. So this is Abby Hines. She is a nurse practitioner with the Eau Claire City County Health Department. She splits her time between providing sexual and reproductive health services in 5 different counties, including Clark County, nursing student coordination, and nursing practice support. Abby started at the Eau Claire City County Health Department 12 years ago and has worked in most roles that a public health nurse can work in, including communicable disease surveillance, immunization, and maternal child health home visiting. Her experience providing care to individuals and the community has made her passionate about educating on HPV and its prevention. Kristen Weiler-Knights, PharmD, earned both her Bachelor of Science and Doctor of Pharmacy degrees from the University of Wisconsin-Madison. Since joining Snipeman Pharmacy in 2010, she has played a key leadership role in its growth and clinical services. She has served as pharmacist in charge since 2012 and became owner in the year 2016. Dr. Weiler-Knights is committed to delivering innovative, patient-centered care and advancing the role of independent pharmacy within her community. Dr. Timothy Golemjeski, or Dr. G, always saw himself going into family practice. From a young age, he was taken to a primary care provider for everything, and he envisioned himself doing that too. Dr. G sees patients with a variety of ailments such as hypertension, diabetes, osteoarthritis, and other chronic conditions. He also provides care in sports medicine, health maintenance such as newborn exams, well-child checks, routine adult health care, women's health, including birth control counseling, and Medicare wellness visits. He is board certified in family medicine, and as a native Wisconsinite, he is happy to bring family practice to rural communities in Stratford and Neillsville and establish relationships with his patients. Dr. G went to medical school at Ross University, School of Medicine, Dominica, West Indies. He completed his residency at Metro Health Medical Center, Cleveland, Ohio. He is married and has 3 children. In his spare time, he enjoys hunting, fishing, hiking, football, rugby, and spending time with his kids. Okay, so for this expert panel Q&A, I do have a facilitator-led question for each one of our panelists. So I think we can stop sharing so we can see them well. Let me know when you're ready.
We're going to do this. Hold on. We're going to do this, I think. See how this looks.
Let's start with Abby. There are statements circulating on social media that the Gardasil 9 vaccine causes infertility. What is your response?
Well, thank you, Kelsey. Thanks for having me. You'll probably see me referencing my notes because Kelsey knows very well that I am very passionate and I can also ramble a lot when I'm talking about HPV and prevention. So just to be aware, if I am looking off screen, it's because I'm probably checking my notes. So I want to acknowledge that when we're talking about infertility, that's a really challenging and sensitive topic. And I understand why people have lots of questions about infertility and how it could be related to the HPV vaccine. I think just to start, like, what is infertility? So it is basically the inability to achieve a pregnancy after a certain amount of time that a person has been trying to get pregnant. And it can often require medical intervention and medical evaluation to help someone achieve a pregnancy. And there are a lot of known causes of infertility, including lack of sperm or low sperm count, obstruction or irregularities in the reproductive health organs, as well as hormonal dysfunction. And we'll talk a little bit more about that last one. And then another important thing to know about the prevalence of infertility is that it affects 1 in 6 people, which is quite a few people that are affected by infertility. And another important thing to know is that that actually hasn't changed over the last 25 years. That rate has remained the same. If HPV vaccine were causing infertility, we would have expected for that rate to increase over the last 25 years. But it does seem like we are hearing a lot more about infertility, and I think that's probably related to more awareness and more access to information. We can see and hear and read a lot more on the internet, and there are a lot more. There's a lot more access to services related to fertility as well, which may also lead to the belief that there is more infertility now than there was 25 years ago. So where did the concern come from about HPV and infertility? Back in 2012, there was a case report that was published in a really well-known medical journal about an individual that developed what's called primary ovarian insufficiency, which basically means their ovaries stopped working. We need our ovaries so that we can get pregnant. But this was just a report of one individual. And I think that's one of the most important things to take away, is that there have been a few case reports, but they were limited to a few individuals. And so while there may be people anecdotally seeing this happen, there aren't large scale studies or like rigorous scientific research showing that there is an association between the HPV vaccine and infertility. In fact, after those case reports were published, there has been a lot of look at what the data is, and that includes the CDC looking at over 200,000 people that were vaccinated with the HPV vaccine and not finding any adverse outcomes related to fertility. There's been several other studies across the US and across the world that have also reinforced that there is no association or connection that's known between the HPV vaccine and infertility. I think another important side of this is that we know that persistent infection with HPV, so when someone is exposed to HPV and their body can't get rid of that infection on its own and it persists over many years, that's when it leads to certain types of cancers. And with cervical cancer, that can lead to infertility, especially when we're looking at people that need to get treated for cervical cancer or precancer. So actually getting HPV can lead to infertility. So I think that's the important other part of it to think about when you're thinking about fertility related to HPV. I think that's all I have, but if anyone has any questions or if I missed anything, please feel free to jump in and let me know.
Okay, thanks, Abby, for that all-encompassing response. I love it. I think we're going to continue to move through the facilitator-led questions, but if anybody has follow-up questions to what Abby just said, if you want to put that in the chat, we'll circle back to that. So next, Kristen, when parents ask about the ingredients in vaccines, how do you explain their purpose and help reassure families about the safety of these ingredients?
So I am going to just reiterate a lot of the really good information that you provided in your presentation, 20 minutes ago. So when parents ask about vaccine ingredients, I start by acknowledging that it's completely fair and it's important question, right? As parents and caregivers, we should know exactly what's going into our children's bodies. I explain that every ingredient in a vaccine has a specific purpose. Some of those ingredients help improve the immune response more effectively. These are called adjuvants. Others keep the vaccine stable so it works properly during storage and transport. And a few are used during the manufacturing process to ensure that the vaccine is clean and safe. One thing I emphasize is the amount of these ingredients are extremely small, often much lower than what we encounter naturally in our daily environment, in food or even in our own bodies. For example, ingredients like aluminum or formaldehyde sound concerning at first, but they're present in tiny, well-studied amounts and have been shown to be safe. I also reassure families and parents that vaccines undergo extensive testing before approval and are continuously monitored for safety. Organizations like the CDC and the FDA review both the effectiveness and safety of every ingredient, not just the vaccine as a whole. And most importantly, I just try to keep that conversation open so that parents can, ask questions and be available, to answer questions. I think sometimes I also just provide information that, I don't make recommendations to my patients that I, won't also do for my own children. If that provides some peace of mind as well, that I, intend, my children are not of the age to be vaccinated quite yet for HPV, but with regards to all of the childhood vaccines, I'm a firm believer in them receiving everything that is recommended through the ACIP guidelines. And I'm happy to share that my faith in vaccines in general, and that, if that helps squash any of their concerns as well.
All right. Thank you, Kristen. And then, last but not least, Dr. G. A common fear among parents is that vaccinating against a sexually transmitted virus will encourage premature sexual behavior. What is your response to a parent when this concern is raised?
Right. Well, those that may have seen me or know me or have seen me in clinic or things like that, I can't see who's all on. What you'll know about me is I'm very straightforward. I don't sugarcoat things, and let's face it, I'm not always the most politically correct because I feel like I want to be much more personal and real and with the. One, I'm going to say, yep, you were right. I really need to go back because that is very out to date. I actually have 4 children now, all boys, and my oldest is 9. And so with this, there have actually been a multitude of research studies on this because, again, as a parent, the last thing, especially when they are young, under their age, the last thing we think or hope or wish to encounter is our children being sexually active. And it's hard for us to think about the future of that. And then because this is a sexually transmitted disease and it's a vaccination against sexually transmitted diseases, our minds are automatically going to go, oh, you know what? We're vaccinated against this. They are automatically going to become sexually active or they're going to start having more partners. That's a natural thought. And I tell parents this, but it doesn't. Think of it this way with all these studies. They took 20 some studies and they looked at over 500,000 participants total, some that were vaccinated, some that weren't. And what it showed actually is that there was no increase at all in earlier stages of onset of sexual activity. That's oral, vaginal, etc. And it actually did show that females that were not sexually active that were vaccinated early actually tended to have less partners. And does it mean that the vaccine caused them to have less partners? No, I'm not that naive. But realistically, what it did is it also created some education around it. It showed that the younger children, teens, that there is consequences to not having protection and things like that. And so really with this, it really did show that it does not lead to any earlier sexual activity. And right, like what we're talking, starting vaccinations at the age of 9. Why does this work, and why do we recommend it before sexual activity? Is, again, poor example, but when they're a teen, you're going to teach them to drive. Are you going to have them buckle up after the car accident? Or are you going to teach them right away? And that's the prevention. And we know more and more, and it's already been hit on multiple times, cervical cancers. Cervical cancer is awful too. Like, it is a devastating thing. Why do we not think about that until much later on? Because teens, young kids, they're not the ones getting cervical cancer in general. It's not happening until they're much, much older. And as they hit on, eventually, most of the studies are actually showing that a lot of our cervical cancer screening, we can probably just do HPV testing. And if the HPV is negative, well, we're good. We'll be good for a while unless there comes issues. And if it's positive, then it's going to lead to the screening and then of the pap smear and things like that. And so really getting ahead of this, this is not a new vaccine. Those of us that are young still and have children, before it was recommended just for young females, because females were the ones that were getting affected. We knew it could affect things, but as typical, who's at fault? The male, because again, as it's already been hit on numerous times, is that there's no symptoms. Typically, it just gets passed around, and it is the most common sexually transmitted disease or infection across the world, period. Like, no ifs, ands, or buts. And to be able to have the opportunity to vaccinate against this is just phenomenal. And you saw Thad's story about this, right? Like, I get it. There's concerns that we're going to increase possible early sexual activity. It doesn't. And again, I'm going to relate it back to reality. You're telling me they don't see any of that extra activity, that exposure from our ads, TV, movies, TikTok, everything else like that? Getting the vaccination, zero of increasing that sexual activity, zero of starting it sooner. It's multifactorial, and all we're doing is trying to help protect. I'll be honest, I'm married. I've been happily married, at least according to me, 11 years. I don't know, can't say what my wife would say, but they didn't have the vaccination for men when I was growing up. Once they approved it and extended the age limit, I got my HPV vaccinations just a few years ago, and I'm married. I don't anticipate my wife and I leaving or being with anybody else or anything like that. But again, if we do go different paths or whatnot, I want to be able to protect myself and protect any future partners. And again, it's really just about getting ahead. And for me, yes, many vaccinations are very important. I like to also put it this way: is follow the science, follow the data. I know there's a lot of stuff out there on the internet. There's a lot of celebrity things. There's political people and things like that are against it, or bring up a lot of stuff. It's really hard to tell what's true and what's not anymore with AI and everything like that. The data is solid. We're not skewing it. I promise not one of us that are either prescribing it, recommending it, or anything else are getting any sort of kickback on this. The reason we recommend it is because as practitioners, we care about you, we care about your kids, we care about their health, we care about our community. And all we want to do is really take care of you. We get nothing for this. Nothing at all. And I truly believe it's your body, it's your decision. It's the younger kid's body, your decision. But really driving forward and thinking about not today, but how can I help protect them in 10, 20, 30, 40, 50 years from now? And this is one of the things that we know in science, in the medical community, it works. It works. And again, there's a lot of hesitancy. I'm always open to communication. Again, those that know me, that have ever seen me or heard about me, know this is pretty much what you see is what you get. I'm more than happy to educate. I'm more than happy to talk through things. Again, as you're hearing, it is super safe. For those that are complete naysayers and things like that, it would be like blaming the seatbelt for a seatbelt burn or the bruise across your chest in an accident. It saved your life. Yeah, there's side effects, sore arm, some mild things, but the benefits greatly outweigh the risks. Sorry, long day of clinic. Thank you so much, everyone, and I really appreciate everyone that's in here and everybody that put this together. And it's not as big a group, but I even was messaging back and forth. And even if we had one person here, one person online, that one person, if we can answer your questions, if we can make you feel comfortable with things, and you can be that next voice that tells the next person, the next friend, the next that makes a world of difference, and that helps our community.
Okay, good. Well, thank you very much for that. I am sure your patients appreciate that you are straightforward with them. I appreciate your humor, and I also love the analogy of the seatbelt. I think people can understand that and connect the dots there. So thank you for sharing that piece as well.
Absolutely.
Okay,
and I will
so
say, my 9-year-old has his first shot.
Yay! So Corinna's telling me that there are no questions right now in the chat. I know we're past 6:30, but given we don't have a big crew here in person for the informal networking piece, if anybody wants to come off mute and ask any of our experts or Thad if he's still on, any questions, we can continue the recording for a bit here. If not, that is totally fine as well. So I'm just going to give a little bit of silence just in case anybody wants to come off mute.
So, absolutely.
Yeah. Kristen put in the chat that bottom line, it's a cancer prevention vaccine. If only there were more cancer prevention vaccines. For sure.
Absolutely. All right. So just a couple final notes here. So I just want to thank everybody for joining us, our expert panel members, Thad, our ambassador and his testimonial, everybody in this room, all of the attendees online as well. I know everybody's day is busy, so I just thank you for taking some time out of your busy day to learn and ask questions. We highly value your feedback, so if you do have time to complete a brief post-event survey, you can do that now by scanning the QR code. As mentioned earlier, we are sending this link out via email in the next business day or two, so you will have an opportunity to complete it later if desired. As an additional note, all of the materials, including the presentation recording, will be posted and available on our Tri-County Immunization Workgroup webpage. If you are interested to receive our workgroup's online newsletter, you are welcome to sign up on the webpage on this slide, which you can access via the QR code. So at this time, we are going to say farewell to our virtual attendees as we shift to the informal networking optional section of this event. So I just want to thank you again for joining us, and we are going to be stopping the recording.